Well, actually, stem cells have just been the research and just what's been out there about them. It's always been amazing and intriguing to me as far as just the research and what's done. Is I began to hear more about what stem cells were and learn about those in my own education but what really has brought me around to using them and defining them as a tool for my patients. My father and I both have been studying stem cells for quite some time. And my father was looking at having to get knee replacement. We were talking about trying to do alternative therapies to try and keep him from having to get stem cell therapy. And
Right.
He's an alternative medicine specialist as well. So we've been conversing back and forth, both doing research into different things. And we use some other therapies here, laser therapy and some of these other things that are regenerative in their nature. And we were just looking to try to find a way to help him. And stem cells kept on coming up. It was one of the big topics that kept coming up. We kept visiting about it, kept talking about it. It was interesting. There was a lot of different stances as far as what different people were saying about how effective it was and then where the FDA stood on the ability to do.
Well, I've got a letter in the mail about a seminar for stem cell regeneration, and I didn't know anything about it. I didn't think much about it. Finally, one day I was looking at it, and it was the day that the seminar was, and I was to the point where if I didn't get in the seminar, I was going to schedule a knee replacement that same day. But as it turned out, I got in the seminar, and it hadn't been anything but great. It's no surgery. I'm 1,000 times better than what it was. Pain-wise, I'm probably 70% back to, well, I don't know, 10, 12 years ago. So it's been a good deal for me instead of having to get my knee cut out and replaced. The stem cell is worked for me. So I really don't know what else to say other than it's well worth the visit to come down here and talk to Dr. Parker and see what he has to say. He'll tell you whether it's worth it or not, if you're a good candidate or if you're not. So anyways, that's kind of my deal, and I highly recommend it. So at least give it a shot.